Even Zimbabwe's bankrupt government now admits there's a national emergency. Sewage and healthcare facilities hardly exist. The country's 12 million people lack money, food, and clean water, and it's killing them. 600 or more have died in an epidemic of cholera the UN says has infected more than 12,000 people. Just outside the nation's capital, water from wells like this one reeks of sewage.
I'm very afraid of cholera, but there's no substitute where we can get clean water. We rely from these wells.
Spread by contaminated food and water, the disease has followed a tide of desperation to the border with South Africa. Medical help is meager, but as one man put it, our own hospitals in Zimbabwe are a dead zone. Most of the blame falls on the misrule of Zimbabwe's 84-year-old President Robert Mugabe, who's still in power despite losing an election this year. Now the calls for his ouster are getting louder. From Europe and the U.S.,
it's well past time for Robert Mugabe to leave. I think that's now obvious.
And from his neighbors in Africa.
He's destroyed a wonderful country, a country that used to be a breadbasket. It has now become a basket case itself, needing help.
If there's hope in all this misery, it may lie in what a Zimbabwean writer calls the cholera effect, a disease that's crossing borders and a crisis growing bigger that could become the catalyst for change. Richard Roth, CBS News, London.